Dr. Dang Vu, thank you for taking care of our Medicaid patients. Healthcare saves lives. Covering everyone is a moral obligation that we have to our neighbors and our fellow Wisconsinites. No one should be sick and not seek healthcare because they can't afford it. I know what it's like to live without healthcare coverage. My family and I went without health insurance for almost 2 years, and during that time, I took a call no mom ever wants to take, that my son needed emergency surgery. 3 scars and $15,000 bill later, we took out a second mortgage to pay the bill. And many of my friends and neighbors were in the same or similar predicament. You feel embarrassed, ashamed, like it's your fault, but it's not your fault. The entire healthcare system is broken. I strongly support expanding Medicaid as far as we can under the Affordable Care Act. And as governor, I will put providing healthcare for all at the top of my list. Medicaid makes it possible for 1 in every 5 Wisconsinites to get healthcare. And Medicaid expansion will cover 79,000 more people and free up $286 million. Money that we can use for making an investment in a community-based mental health and addiction recovery system. Why is it that Minnesota has a similar population, similar crime rate, but half the number of people in prison? It's because years ago, Minnesota invested in a community-based mental health and addiction recovery system. While in Wisconsin, when we look at our prisons, 70 to 80% of them have addiction issues, and more than 30% have diagnosed severe mental illness. We can follow Minnesota's path to treat mental health and addiction instead of putting those folks in prison. Mental health and physical health are very closely intertwined. Recently, I heard a story from a county supervisor who thanked me for helping the county get a grant that gave alternatives to incarceration. The man I'll call Frank was facing his 3rd or 2nd OWI. And when the drug counselor said, "Why do you drink a quart of alcohol a day?" he said, "Because my teeth hurt. Because my teeth hurt." The drug counselor got him onto the Medicaid program. She got him help for his furnace, which has gone out. She got him help for his hernia. The dentist pulled all of his teeth, and after 2 months of antibiotics, he stayed sober, felt a lot better, and was able to go ice fishing, something he hadn't enjoyed for years.